You are welcome to my channel. Today I'll be addressing hemophagocytic lympho histiocytosis, but limiting myself to the differential diagnosis only. So, if it's not HLH, what could that be again? It might be TTP, thrombotic thrombocytopenic purpura, or HUS, hemolytic uremic syndrome. Might be transfusion-associated graft versus host disease, and might be encephalitis. The list of the differential diagnosis of HLH could be Kawasaki disease, might be sepsis, or severe inflammatory response syndrome. Might be liver disease because we're going to find hepatomegaly, right, and bilirubin that will be rising. So, maybe it's just liver disease or liver failure. It might be child abuse when you find bleeding, rashes, and splenomegaly, thinking that this child has been abused, right? Or it could be drug-induced thrombotic microangiopathy. May also be infections like bacteria. In this case, it might be tuberculosis. So thorough history, physical examination, and certain investigations well. Might be fungal infection or parasites. The presentation might give us concern that are we dealing with Epstein-Barr virus, cytomegalovirus, or human immunodeficiency virus. The differential diagnosis will include cytophagic histiocytic panniculitis, or dress. I'm not saying you dress yourself, you wear a nice clothes, meaning drug reaction with eosinophilia and systemic symptoms. Might be ALPS, that is autoimmune lymphoproliferative syndrome. Now finally, still on the differential diagnosis of HLH, it might be macrophage activation syndrome or reactive hemophagocytic syndrome, and it might be multiple organ dysfunction syndrome. Remember, in the course of the full presentation on HLH, I have stated clearly that there might be infection going to sepsis, going to severe inflammatory response syndrome, and hypotension and multiple organ failure. But it may not be. It might just be multiple organ dysfunction syndrome. So with that, I've come to the end of this short presentation as per the differential diagnosis of HLH. So if it is not HLH, what could that be? Rewind, pause, rewind again. Check through this presentation and find another diagnosis that you can work upon so as to help that patient out of the problem. Thanks for listening. Remember to subscribe to my channel so that you can get all my presentations immediately they are published. Remember to share this with all your colleagues and friends. And there's another presentation, full presentation on HLH from the terms fully defined, from clinical features to diagnosis and treatment, prognosis, and even relapse, even complications, all published right there. Check my channel for that. I appreciate it.